In this video, I'm going to teach you what Sibo is, what causes it, where your doctor is most likely going wrong, and the 7 steps to get rid of it for good. Number 7 is key, so don't miss it. Sibo is an overgrowth of bacteria in the small intestines. It's not even necessarily bad or pathogenic bacteria, it's just simply where it doesn't belong. We should have lots of bacteria in our large intestines. You want them there. They help you break down your food. They help make B vitamins and neurotransmitters. They're super important, which is why many people take probiotics. But the key is your large intestines were designed to be home for these bacteria, for them to be able to break down the food, ferment them, and do their job. The problem comes in when these bacteria end up in your small intestines and they try to break down food and do what they do in your small intestines. Now, your small intestines were not designed for this process. So this is where you see a lot of the symptoms come in, like gas, pain, and bloating. The more insidious problem is malabsorption. This can lead to malnutrition if gone untreated. Some other common symptoms of Sibo are diarrhea and constipation, depending on which type of bacteria you have. More on that in a moment. Food sensitivities from damaged GI tract, fatigue, anxiety, depression, and brain fog from the inflammatory cytokines that are released, nausea from slow stomach emptying, anemia and low iron due to malabsorption, acne, interstitial cystitis, and more. So the underlying cause of Sibo is really complex. There's a lot of layers to it and it's pretty complicated, but I'm going to go into a few of the highlights here so that you can start thinking about what might be going on for you. Reason number 1 is a faulty ileocecal valve. So the ileocecal valve is a valve that's in between your large and your small intestines. It should be closed most of the time. It should open up for food to be able to pass through, then it should close again. Problems arise, however, when it gets stuck open or is open for too long. This is when we can see a migration of those good gut bugs that are in the large intestines up to the small intestines, like I talked about earlier. Reason number 2 is a delayed migrating motor complex, or an MMC. So the MMC is called the housekeeper wave of the body. It comes through about 4 to 5 hours after you eat, and it cleans everything out of your small intestines. Super important for that to work properly, otherwise you're going to end up with undigested food particles that could feed any bacteria that traveled in with the food. Or if you also have an ileocecal valve that's open, the large intestine bacteria came up, now you're giving them food too, they're going to be able to really thrive and grow even more and more where they should not be. Reason number 3 is food poisoning from things like E. coli, Shigella, and C. difficile. Now, this can cause a release of a bacterial toxin. This toxin can interact with the nerves of the small intestines and delay that migrating motor complex or damage it completely. Now, we just learned a moment ago how important that migrating motor complex is. If you have food poisoning from one of these toxins or other ones, there's a chance that your migrating motor complex might not be working properly because of the food poisoning. Reason number 4 is low hydrochloric acid, or HCl. Hydrochloric acid is going to kill the bacteria that comes in through your mouth and nose during the process of a normal day. If your HCl is not high enough, you're not going to be able to kill off that bacteria. The bacteria stays alive in your stomach, moves on to the small intestines, then it can set up shop and develop Sibo. Even if you don't have bacteria that travels through during any given day, if your hydrochloric acid is too low, as it washes out of the stomach into the small intestines, it's not going to be strong enough to kill off any bacteria that might be in the small intestines. Unfortunately, today, many people have low hydrochloric acid. There's many reasons for this, but the most common one I see is being on an acid blocker like a PPI. That reduces the acid content of the stomach, and that can contribute to Sibo down the road. Reason number 5 is structural issues. That can be anything from partial adhesions, from C-sections, hernia repairs, tummy tucks, all the way to a non-draining pocket, which we would see with small intestine diverticulitis, or even blind loop syndrome. Any of these can allow the bacteria to be hidden in these spots and not pass through properly, even if the migrating motor complex is functioning. So now that you know what it is and what causes it, let's talk about treating it. Of course, this is even more complex than what could cause it, but again, I'm going to do my best to lay out a few different treatment protocols for you that you can go and discuss with your doctor. One really important thing to keep in mind is that this is not a one-size-fits-all approach. If you are working with a medical practitioner and they are trying to give you a one-size-fits-all approach, you might need to find a new practitioner. This should be very individualized to you and your Sibo and what's going on in your body. Now, one of the things that I alluded to earlier is different types of bacteria. So there's generally two types of bacteria that we see in Sibo. There could be the methane producing or the hydrogen producing. These are the gases that the bacteria give off. You could also have a combination type. One of them is more prone to constipation, one causes more diarrhea. Combination type, you can alternate between the two. Now, which type of treatment you do is going to depend on which type of bacteria that you have. Another reason why you want to individualize is, again, going back to that root cause and what's causing it for you. So a great example of this would be trying to treat a patient that has adhesions with giving them hydrochloric acid. Now, it might treat the Sibo initially by killing it off from the acid, but a week later, they're just going to get Sibo again if that adhesion is still there and still causing the bacteria to get stuck behind it. Okay, so now I've got my little disclaimer out of the way about how it needs to be individualized to you. Let's talk about some different treatments that can help. Number one is antibacterials. This doesn't have to be an antibiotic or pharmaceutical. It can be, but no matter what, you're going to need something that kills bacteria because Sibo is small intestinal bacterial overgrowth. If you are going to use antibiotics, I highly recommend that you use one that does not go throughout the body. Now, my favorite one for this is called rifaximin. Rifaximin has been known to stay only in the small intestines and not travel into the large intestine. And the reason why this is important is because, like I said earlier, we need these bacteria. They help us. We want them. We just want them in the large intestine. So taking something like a rifaximin is going to help kill off the bacteria in the small intestines only, and it's going to leave your large intestinal bacteria untouched. Now, if you're going to use herbals, you need to know that it's going to take a little bit longer. This isn't a bad thing, but you do need to plan accordingly in your treatment protocol. Often, a combination of herbs is important to be able to really kill that bacteria. You usually can't try just one thing, like garlic pills or olive leaf. You usually need a combination of herbs to be able to really kill off that bacteria, and you're going to need to take it for a little bit of a longer period of time. Number two, this is the step that I see a lot of doctors miss, unfortunately, and it is crucial. So this is Prokinetics. Now, the reason why Prokinetics are important is that their job is to stimulate that migrating motor complex. Prokinetics will help move things through your small intestines into the large intestines, so the bacteria that's in there gets moved out and nothing can get stuck in there to fester and stay around. So Prokinetics are a really key step. Now, you can take either a pharmaceutical option or an herbal option. For herbals, I like ginger. Again, sometimes a combination is really good for this. And for pharmaceuticals, I think the best ones are either erythromycin or LDN. LDN is personally my favorite. It's low-dose naltrexone. Now, the reason why this is my favorite is because it is also anti-inflammatory and it's an immune modulator. So a lot of the times when I see people with Sibo, it's because they've got something else going on. They might have Hashimoto's, they might have Lyme disease, they've got something else going on that's heavily impacting their immune system. So when they take LDN, that's going to help modulate the immune system, and it's going to stimulate that migrating motor complex to help get rid of the Sibo entirely. All right, step 3. This one's not for everyone, the elemental diet. Now, I do have to say it has become quite the gold standard for treating Sibo. It works fabulously. But the reason why it's not for everyone is because it's hard. What you're doing is you're drinking a chalky substance for about 14 days, and you are not eating food. What this does is it starves off the bacteria while feeding you. So this chalky substance is very specifically medically formulated with amino acids, micronutrients, and macronutrients to be able to feed you, and it has nothing in it that could be potentially feeding your Sibo bacteria. So that's why the elemental diet is really powerful and works really well. Number 4 is a Sibo-specific diet. These are helpful because they will guide you through some typical foods that would feed your Sibo bacteria and then foods that don't feed them. So they're a great template to help you get started navigating a very complex dietary change. Some options for a Sibo specific diet are going to be the low FODMAP diet, the GAPS diet, which stands for gut and psychology syndrome, the CSD diet, which stands for the cedar-cyanide diet, or the SCD, which is the specific carbohydrate diet. Now, whichever one you choose, you need to know that you still are going to need to customize it even more beyond whichever one you pick. And the reason why is because everyone's bacteria is different. So you need to find what aggravates and what flares your symptoms and what doesn't. So you can take one of these diets, use it as a starting point, a guiding post, as a template, and then you're going to customize from there as you go along and find out what works exactly for you. Number 5 is meal spacing. Now, the reason why this is important is the migrating motor complex, which I just talked about. So if you are constantly eating and constantly shoving food in your face, you are not giving your body a chance to go into the migrating motor complex house cleaning wave. So if you're just eating all the time, it doesn't have time to move things through, and then you get a backlog of food and bacteria and everything just sits there. So I recommend trying to space your food out 4 to 5 hours if you can between meals and snacks. Now, if that seems impossible, start small wherever you are. If you're at 2 hours, try to go to 2.5, then 3, then 3.5. See if you can work your way up to 4 or 5. If you can't, that's a really good sign that there's something else going on in your body. You're going to need to look into either adrenal dysfunction or blood sugar regulation are kind of the top 2 reasons that I see for people not being able to space their meals appropriately. If you can, work towards 4 to 5 hours. You're going to give your body much more time to do the migrating motor complex and get everything cleaned up and out of the way. Number 6 is manual body work. Like I mentioned earlier, there's several physical reasons why you could have Sibo, like adhesions and your ileocecal valve being stuck open. Manual body work is really important. 1, in the treating process to make sure that you're moving everything out of the way in your treatment protocol. And then 2, it's really important to make sure that that's taken care of so that the Sibo doesn't come back. Some of the best forms of manual body work for Sibo are going to be visceral manipulation, craniosacral therapy, and abdominal massage. So look for someone in your area that does manual body work and see if you can incorporate that into your treatment protocol. Number 7, this is where I see a lot of doctors go wrong. Find the root cause. I see a lot of clients in my practice that have gone to a doctor, they do a hydrogen breath test, it's positive for Sibo, they're given antibiotics, they're cured for a week, and then it comes back. And the reason why is that their doctor didn't find the root cause. So I kind of talked about some root causes earlier, so you guys know some different areas to look for that, but it's really important that you figure out what the root cause is for you. I had mentioned Lyme disease, Hashimoto's. Those are some of the common root causes that I've seen for Sibo, as well as food poisoning, adhesions from stomach surgeries. The list goes on and on. But at the end of the day, you guys have got to push on and keep going until you find your root cause so you don't get stuck on what I am now calling the Sibo train, where you can't get off and you just keep going around in the same circle. It's madness. Find your root cause, guys, so you can really heal it once and for all and be done with Sibo. If you liked this video, make sure you click subscribe and hit the notification bell so you don't miss any videos. And one other really big thing that you can do to help with Sibo is to fix your digestion. So make sure you stay tuned for the next video, and we're going to talk more about how to have proper digestion.